Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts from your journey to Prime Health in life and in business. Now, I want you to think about this. What happens when an emergency physician spends nearly a decade inside of 11 health systems and decides that the real emergency isn't in the ER, but in the broken credentialing system? Today's guest, Dr. Leah Houston, took that moment of clarity and built an AI-driven solution that could free doctors everywhere. Let's get into the story behind Evercred in just a bit. Before we do, I want to just a quick short moment about our sponsor, Growth Solutions. We're your growth partner that turns healthcare expertise into marketing leadership one strategic move at a time. So whether you have your practice and you have some headaches in it of new patient lead generation, clients, patient communication, maybe some operational chaos, and need to have some frameworks and processes placed in there, or if you're looking for AI systems, which Dr. Houston will get into, and AI agents in your practice, we help you because they're an army that's coming whether you want it or not. So whether you've said this to yourself or thought this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help you with Grow Solutions. So drop the word grow in below or feel free to reach out to me on any platform. But you're here for a reason, and that's to meet Dr. Houston. Again, Dr. Houston, welcome to the Prime Health Podcast, and tell us a little bit about yourself and your story.
Yeah, well, thank you so much for inviting me on the show. I'm really excited. I'm an emergency doctor. I practice across the U.S. for 10 years. And most people don't realize is when a doctor needs to start working, after they've gone through the interview process, after they've gotten a job, or even if you're in private practice, as soon as you want to actually accept payments from Medicare and Medicaid, you have to go through a process called credentialing. And under the umbrella of credentialing is licensing, hospital privileging, and enrollment in insurance, Medicare and Medicaid. And so there's a lot of things under that. And, as a locums doctor, I had to go through this process 11 times at those 11 hospitals that you mentioned. And, it takes 4 to 6 months for them to manually verify that I actually have a medical degree, that I actually have a DEA to prescribe controlled substances. They have to check my procedure logs from the hospitals I've worked in. All these things are my credentials, and they have to manually check them. And that's why it takes 4 to 6 months. So, hospitals lose an average of about $1.2 million per credentialing event. It's about $9,000 to $15,000 a day of lost revenue that they're losing every day that I'm not working. And it's not just about money, it's my salary. I'm sitting twiddling my thumbs. I can't make money until this is done. And then they're also losing the revenue. But also importantly, if doctors aren't working, patients aren't getting seen. Yeah. And there's a shortage of doctors. And so, this leads to delays in diagnosis and death and disability. And so I set out to fix it. Yeah.
So, and that's how Evercred was born. So I can't wait to hear more about it, but I want to jump back a little bit. And I always ask the question, was there a moment in your life or a circumstance that happened that said, I want to go into medicine myself?
Oh yeah. The practice of medicine. I was always really good at science. Okay. And, but I also loved working with people. And so there's very few industries that you actually get to work with people when you're really good at science. You're either behind a bench doing lab research, or you go into medicine or, things like that. So I found medicine through, my science world and getting recommendations from people that, were like, oh, you should go be a doctor. And so I said, oh, okay. And I went into it, and I loved it. I actually missed it a lot. I loved practicing emergency medicine. It was extremely rewarding. Patients were always the most grateful that I could have ever imagined. And, it's kind of a bummer that I'm not practicing now. I might go back to it someday. We'll see.
Well,
Yeah.
I'm sure the patients will be willing to bring you back for sure. I know it's like, I appreciate how you say it's rewarding, but there's got to be some amazing highs and some amazing lows, what you see as an emergency room physician.
I mean, yes. However, bad things are going to happen. And it's kind of like, it's an opportunity to be able to fix those bad things and to recognize them and to make that diagnosis and to treat that person. And yeah, you see horrible things. I mean, I actually, during residency, was called in to do chest compressions. And, I was called in, I went to the patient and there's chaos all around. And, I'm doing chest compressions and we end up calling it. And I walk out and 10 minutes later, I realized that was my godfather,
Oh my.
yeah, because I went to residency where I grew up. I've had,
Wow.
people from high school that are there on a psychiatric hold. There's family and friends that I've seen. I had bad things that happened to people that I knew
Yeah.
during residency. So that was hard.
Yeah.
And, children also, especially, I had a hard time with kids because they're so innocent. They don't even understand what's going on. And
Yeah.
the stuff you see, it's the stuff you see on Dateline. It's not good.
Yeah. Well, you're on to bigger and better things, I guess, from a mental standpoint, I hope, at least. I'm sure it's not always easy in the Evercred world, but it's a better situation. Maybe it doesn't pull on the heartstrings as much. So when you went across these 11 different hospital facilities, like you were, was it more of a frustration for you personally, or the frustration of the entire group as a whole that said, I need to do something, that birthed the Evercred development?
Well, actually, I mean, it was frustrating and it was annoying, but there's a lot of frustrating, annoying things we have to do. There's uncompensated administrative burdens at every corner for doctors.
Yeah.
What actually happened was a hospital that I had previously worked for was committing insurance, Medicare and Medicaid fraud with my medical credentials.
With your credentials.
Yeah. So they were billing on patients after I left the hospital, after I was no longer in the state. And it led to a huge issue with me where I had to hire a lawyer, and it really shed a light. Okay, this isn't just some annoying paperwork thing. This is an enormous source of fraud.
Yeah.
And, I'm kind of one of these people where it's like, okay, I was in the vortex of that legal issue briefly, but I'm also a problem solver. So I'm like, what is going on here? How can this be solved? And I realized that the core root of the problem is that people don't have any ownership over their data. They kind of have to rescind and give up their credentials to wherever they are. And those individuals use them in whatever way that they want. And there's no real clear accountability around that. And so I spoke to a bunch of other doctors about this problem. They all agreed it was a problem. And so I set out to fix it.
Okay. Good. Right. Took action on it for sure.
Yeah.
So when you talk with other physicians today, or even in the past, as you started doing that, what part of the credentialing or the onboarding process do they say is the most draining or the most demoralizing that they go through?
The having to repeatedly do the same thing over and over again. We went to medical school once. Why isn't there one place that we can keep our credentials and it's verified that it's real? Why do we have to repetitively do the same thing? It's kind of like, it's demoralizing, especially since our time is so limited. It's really not a good use of our time.
Yeah. That, if you want to drive, you have to have a driver's license. If you want to drive in different states, you've got to get a license in different states. I can understand that. But if you're in the state,
Not true.
Yeah. If you want to live there, if you want to be a resident.
Yes.
Yeah. They would like you to have the driver's license. But I can assume if you're moving in different places in the state and having to get credentialed every time, that becomes different. And that brings us up through the Evercred credential wallet. What does that really allow physicians to do now that wasn't happening in the past?
I want to answer that, but I do want to talk to you about the driver's license thing.
Oh,
Because
please,
this is an actual good analogy as to why this process sucks so much.
Okay.
Okay, I live in, Florida and I want to drive up into Georgia. I'm allowed to do that with my Florida driver's license.
Okay.
There's interstate driver's license reciprocity, where each state DMV is aware of each other, and the police departments are aware and they're able to scan all the licenses. That's not true in medicine. But does the practice of medicine really change over state lines? There might be some different rules, but there's also different rules on the road in different states and different towns. So that's one issue that we are addressing, that we're planning to address, and so you had asked about the difference between the old way of doing things and the way that things are going to be working when you own your data.
Mm-hmm.
So right now, physicians, where do they keep their credentials? Some of them keep copies in a folder in an actual file cabinet. Some keep them on their desktop. Some people have Dropbox or Google Drive.
Mm-hmm.
They're kind of all scattered. There's maybe if you've properly organized them and labeled them, it's a little easier to find them. And then they have to share those credentials. Sometimes they send you a packet in the mail and you have to physically mail them after filling out the redundant forms.
Yeah.
Sometimes you have to physically go in and put them in external software systems and create a new login. Sometimes you just email them and somebody else has to do that. But it's still work every time that you have to do. And then it's not only when you are first enrolling in insurance and first working, it's actually repeatedly required for regulatory compliance every 2 years. So this isn't a one-time thing. Even if you work in the same hospital your whole career, it still keeps happening and happening. The way things are different now is the currently available systems are essentially software systems where you either upload or somebody else uploads this data, and then they go manually verify it. And then they, document proof of manual verification. That's called primary source verification. But then if you leave that hospital, you lose all that data and you got to start all over again from scratch. So the way we're doing things differently is we're creating a wallet where you can upload your credentials, AI extracts the data, writes everything down, the AI pulls the data out so you don't have to manually do anything. And then we're building agents, AI agents, domain-trained AI agents that will then go pre-verify that data for you with a click of a button. So rather than having to spend 4 to 6 months with one person manually checking this, you can deploy dozens of agents from your credential wallet and have this done in moments instead of months. And when you leave the system, that data stays with you because you have your wallet. So when you share that data, it's now permanently and perpetually, repeatedly verifiable.
Okay. Is there I don't want to get anyone in trouble with this question, but is there an organization? Are there who doesn't want this to take place?
I don't think anybody doesn't want it, except for maybe the currently existing credentialing companies who charge for their services.
Okay. So all physicians would like for this to go through. Hospitals would like it to go through because they don't want to lose, loss of work and loss of time and hours. So it's just that you're the first to the market, hopefully, and there won't be many competitors that come along after you, because I can see how this will be beneficial, especially when you explain that driver's license component. Makes me think a little bit more of how that works. And again, if you want to say, okay, for 6 months, I'm going to move from Florida, I'm going to move to Texas. Instead of for 6 months, I have to wait for 6 months for me to be able to work.
So you're talking about licensing specifically.
Okay.
So we're not eliminating the need to apply for a license.
Okay.
That's still something that has to happen. Can we agentify that process? Yes, we can agentify that process. That's a little bit more complex because it requires actual interaction.
Mm-hmm.
But there are pieces that can be automated. And I believe that our first version is going to have the things that we can automate now, which is, the state licenses. If you already have one, we can verify it in an automated way. The application process is something that we need to do down the road.
Okay.
But yes, we can make those things more efficient, more automated, and also streamline those as well in the future.
Okay. Dr. Houston, I think this question that I asked, you can point it to where it will be helpful for the physician and also for the patient. Mm-hmm. So if you have this perpetual automated primary source verification that you guys do, how will that change the way hospitals and the health systems move their workforce?
So as a locums doctor in emergency medicine, hospitals had desperate emergency needs sometimes. And so they hired locums companies to fill those needs, but there was still that 4 to 6 month pipeline, So they had to be thinking way in advance and scrambling and sometimes doing emergency privileging and things like that. Now, with a system like this, if I'm needed tomorrow, I can work tomorrow. Similarly, if there's very remote places that the top, ophthalmologist in the top city in the country, I'm not going to name names, they might be willing to spend 1 week, a quarter doing their highly specialized surgery in this hospital. They might want to pick up a little extra work, but this friction of credentialing is preventing that. So it's not only preventing them from being able to go work easily and quickly, it's also reducing access for patients in those areas. So this is a real workforce mobility solution for people to, have a little bit more control over their schedule, people to do side gigs, to work part-time, to help serve communities that are currently underserved and who don't have access to highly specialized practitioners. And it also would encourage people to maybe do a little bit more because there's less work on the administrative burden side of credentialing.
Yeah. So you went to medical school, a lot of knowledge base behind that. You practiced for 11 years and you said, okay, I got to learn something about AI. You took another route itself to learn more about AI itself. Will you explain kind of the process that you took there?
So, yeah, it's funny because when I was an undergrad, when I was first signing up for courses, they were trying to get me to sign up for computer science courses because of my mathematics scores in high school. And I was like, I don't need to learn anything about computers. I'm going to be a doctor, and I actually grew up pretty poor. So we didn't even have a computer or the internet. So I didn't really realize, I'm aging myself now, but I didn't even really realize the impact of where technology was going at that point. I was very dismissive of it. And so it's kind of funny that now I'm working in technology and health tech. So, I went and did training at MIT in AI and healthcare, learned a lot about product development and how to make decisions around product in the healthcare space in AI. Read a lot of startup books, had a lot of really good teachers and mentors, especially around product development, UX, UI, and things like that. So it's been a learning process. It's been a joy. And I like learning new things.
Yeah.
I think a lot of us do.
Yeah. And so are you really getting your hands in there and pretty dirty in coding in a sense with this? Is it more top line thinking?
Well, so I can now with vibe coding. Okay. I'm able to do stuff, but it's not an appropriate use of my time because there's people out there that are better at that. But understanding it is important. So that's I have gotten in the weeds enough to understand what is being done and what needs to be done and things like that. I spend a lot of time on customer research on the UX UI side, on helping the team translate the business requirements into the technical requirements. I'm very lucky to have a very good product officer who does most of that work with me and make sure the team delivers and things like that. And so it's a team effort for sure.
Okay. If you take Evercred 5 to 10 years in the future, you have this fully portable physician workforce, how does that look? How do you think that changes from how the hospitals and the physicians can work together in the future?
Well, I'll use an example from today.
Okay.
My mother had leukemia and she had some pretty bad GVHD of her mouth, graft versus host disease. She had a bone marrow transplant. And she had really bad sores in her mouth for a while. And she had some really bad dental hygiene during that time. And so she had to have some teeth removed and she had to have, some things done. And she's still dealing with that to this day. There's some new things that are popping up. And she moved since she had leukemia. She was living with me in New York City, getting treatment at Sloan Kettering at that time. And now she's living in St. Petersburg, Florida in remission, thank God. But I had to dig into my network, which is a network of over 60,000 doctors, to ask who is a really good oral surgeon in her area, because even I can't Google that information. And patients deserve to have access to that information. And we should be able to easily find the right people and the right specialized treatment in a precision level way. So, for example, I think, if I'm correct, there's around 4 people who know how to take care of neurofibromatosis, who are highly specialized in the care of neurofibromatosis, which is a rare disease. And, how do people get a hold of these people? How do people find them? How do they know? By the time they actually realize they need that doctor and then actually find them and then actually get an appointment, the disease has progressed so much. Sometimes people don't have a choice and they end up passing away or having, disability because of these delays. So the future looks like an opportunity for every single patient to easily search for the right doctor for them, to get the referral quickly, to get the appointment booked quickly, and to have no longer delays. Through our system, we're going to have opportunities for each doctor who's credentialed to basically showcase and sell their services. So if you want to have a quick 15-minute appointment with the best of the best of the best, you should be able to book that if they're available. And it's these kinds of tools that will make that kind of access possible.
So you've basically become a medical physician entrepreneur, which we'll all be grateful for, in the long run, especially once you get this working. A lot of physicians out there, they feel more of a burden when it goes on there, but, very few decide to fix it at a system level. So is this from a personal reason that you're really driven to do this, or is this the good nature part of you?
I mean, I feel like most people are good natured. From a Locke versus Hobbes discussion, I think most people are good. Most people want to do good in the world. I thought I had nailed it with, I'm going to be a doctor. It's one of the few careers out there where you can actually make good money and help people. And then I got into it. I spent my whole youth with my nose in a book. Everybody's out partying and I'm studying. And I get into it and there's this corruption where we're extracting money from the suffering of people. And we as doctors are essentially in some ways being forced to play that game and having to navigate the Hippocratic Oath that we took to serve patients, along with this model of being paid by employers and insurance companies who have different incentives than we do.
Yeah.
And so we need to align incentives. So it's more about, I spent a lot of time, there's a sunk cost situation going on here. I spent a lot of time learning the practice of medicine only to find out that it can't be practiced efficiently or ethically unless we solve some of these inefficiency problems and create aligned incentives. So,
yeah. Do you think that there's a big gap in physicians with the technology understanding of what has to happen? And I guess even because you said, I think something important about owning your data. So yes. Why should a physician, whether they're tech savvy or not, maybe that's two different points, it doesn't matter, but why do you think a physician should own their data?
Well, physicians don't really care about owning their data until they realize that the impact that it will have on their life and their practice. Ownership of their data means an ability to work where you want, when you want, to have whatever access to whatever job opportunity you can work in, to be able to have patients that really need you easily find you without friction. So when they realize that that's what owning your data means, they want it. But the concept of owning your data is not something they think about. And there's this misconception that doctors don't like technology. What actually happened is they took our practice and our livelihoods, they took our medical record that's meant to be my ability to document what happened to my patient, both for myself, for my own remembering, and for me to communicate with other physicians and practitioners about what's happening so that we can optimize the patient's care. They took that medical record and they turned it into a billing record with EMRs. And so physicians are mostly frustrated with technology because the technology has been designed to extract value from the suffering patients instead of to make our lives easier and make documentation about our patients easier, which is what the medical record is supposed to be for.
Yeah. Like HIPAA had a good reasoning behind it, but the amount of paperwork that came with it and the amount of trees that were killed in the process, was a difficult thing. So I can understand it as well. Is this something that you can see can bleed off into other healthcare avenues, such as, is it only working with medical doctors and hospitals, or will it work into other healthcare fields?
Everybody with an NPI needs to be credentialed.
Okay.
Anybody who wants to work, who has an NPI, needs credentialing. They need a license. They need enrollment if they're working in a hospital. If they're working for a telemedicine company, they also need privileging and enrollment through that company. And if they're taking Medicare, Medicaid, or insurance, they also have to have, enrollment in insurance. Okay. So if you want to work in a clinical setting whether you're a chiropractor or an MD, you need to be credentialed
Okay.
and licensed. Yeah.
Yeah. So it'll take, I mean, it will cascade into all professionals with the NPI number, which will be great, beneficial for everybody. Yeah.
Correct.
Interesting. Okay. So where are you in the stage of scaling, startup scaling, growing? Where are you guys at versus when will this be released?
So this is released. It's in the market now.
Okay.
You can go to evercred.com. You can get your wallet. It's free for every practitioner to start the process. You can upload up to 10 credentials, use AI to extract those credentials. You can set up notifications for expiring credentials. That's all free. If you want to upgrade, you can do unlimited credentials and you can get text notifications. And then you can also add on the agentic credentialing, which should be launched in February.
Okay. Can you go further into that, the agentic credentialing?
Right. So if I want my data to be pre-verified, or if I want to be able to share it and have the person I'm sharing it with verify it, domain trained agents can actually do the same thing that humans do.
Right.
Anything that's done digitally, whether it's a phone call, a fax, an email, going to a website, clicking a button, extracting and verifying data, an agent can do that now instead of a human. So, the thing is everybody's like, oh, doctors are going to be replaced by AI. I'm like, no, they're not.
No.
The administrators are,
Yes.
the credentialing specialists are, and they're going to be grateful to have that job taken because they don't want to be doing that because it's boring and annoying.
Yeah. The pressing of the flesh, the knee-to-knee experience, the personalization will never be replaced. No, unless you're somebody in the basement and in your mom's basement and dealing with bots online. Everybody loves to have a relationship with their doc. So it's important that they do that. Can you potentially share any success stories of somebody struggling with it and then getting involved with Evercred and saying, oh my God, Dr. Houston, this has been phenomenal for me?
For sure. One of our investors previously was super paranoid because one time she wrote a prescription. She's in private practice, cash only. So people are like, oh, I don't need to be credentialed because I have my own private practice and I take cash. Well, under credentialing is licensing and you need to be licensed. So that's not true. If you are practicing, credentialing affects you. So she wrote a prescription and the pharmacist called her and said, hey doc, like your medical license has been expired for 3 weeks. And she was like, ooh. Now she'd been seeing patients for 3 weeks and writing prescriptions for 3 weeks. She had been practicing medicine without a license for 3 weeks. So that's illegal.
Yeah.
That's something that she could have gone to, not to jail for, but she could have had her license revoked for life if they somehow had found out. But she quickly scrambled and fixed the problem. And because there was a window of, a 60-day window or something, she didn't get in trouble. However, if she had had a malpractice case during that time, if she had had a negligence issue during that time, or even a malpractice case with no negligence, she probably would never practice medicine again because she hadn't been licensed during that event. So she now has her Evercred wallet and she gets notifications about when her license is expiring, and she's not worried about that anymore. Before, she used to have to go and manually enter into her Google Calendar, your license is expiring in 6 months, and she was paranoid about it because of what happened, and now she's no longer paranoid. So that's one small example.
Yeah, love to hear that. That would be a difficult thing, and I'm glad the technology had saved her from that, and hopefully some other people will learn from this to jump on board with Evercred.
Especially because it's free.
Yeah.
The email notifications are free, so.
Yeah. From the business standpoint, what are you focusing on with Evercred right now?
We are focused on building the agents, which is highly complex, but very exciting.
Yeah. Okay. And in practice, we have our struggles, whether it's with the people around us, with our patients and how we deal with things. What's the struggle with Evercred? Is there a struggle with it, or is it truly just the building of the agents at this moment?
Well, I think that one thing that I've learned, so when I was a practicing emergency doctor, I was never in charge of hiring and managing people. So I didn't realize, the value of good people, how hard it is to find that value. I'm learning that as an entrepreneur, people are everything. So we're always looking for amazing talent. We're always looking for really strong software engineers, And, we're actually hiring a go-to-market engineering specialist right now to kind of embed some marketing systems into our website and things like that. Because if people don't know about us, it doesn't matter how awesome our tech is, right? So, yeah, I think that I have had some challenges with hiring the right people, but I think that we have fixed those challenges, and I'm really excited.
Yeah, good. A diamond in the rough stays in the rough for a long time unless somebody can find it. So it doesn't matter how good your software is and the service that it provides. It doesn't matter. Just like that, the best of the best of the best physicians that work with you that truly do want to go and help out somebody in California and they live in New York. Right now, if they're not a part of your organization, it sounds like they can't do that very fast at all. So not only does the doctor lose, the hospital loses, and ultimately that patient loses out on that physician experience, which is unfortunate. So Dr. Houston, where do you see Evercred in the next 3 to 5 years? What's your vision for it?
Well, in 3 to 5 years, physicians will no longer have friction between opportunities. They'll be able to work to move freely. They'll be able to have their own private micro practice or regular practice easily if they want, which now they find it difficult because of administrative burdens like credentialing. And then the patients will be able to easily find the right doctor for them. We'll be able to easily schedule an appointment through the HPEC, website that we're also launching in early January. That's going to allow you to search for the physicians on the network who do pay for the upgraded wallet. They're going to have that service for them. We're going to put a marketing budget on that so that you can be found as a doctor. Okay. We're going to let you put your own private practice website on there. It's not going to be, book through us and, this kind of cartel system that some of these people build. It's really going to be to serve doctors and patients, and we're really excited about it.
Okay. I love your free speech and how you talk about some of the difficulties that are out there because of what you've experienced in practice and in building the business. So I appreciate that. We'll share all of your links, everything where people can find Evercred. But if somebody wants to learn more about it or about you, where would you like to direct them?
Evercred.com. I'm also all over social media. Leah Houston, MD, across Twitter, LinkedIn, Facebook, Instagram. And we'd love to hear from you, especially if you're somebody who's using the software. There's a little feedback button there. Give us some feedback. Yeah. Thank you so much for giving me an opportunity to share this. I think this is going to change the face of healthcare. Credentialing is embedded in everything. You can't write a prescription. You can't order labs. You can't order an MRI. You can't do surgery. Can't get a job. You can't bill for insurance without it. So it touches everything from clinical trials all the way through. So we think that this is a necessary thing to kind of move healthcare forward into the future.
Yeah. With me not knowing much about it other than the research that I did before, even just in the conversation today, I can see how much more important it truly is. And for those that aren't in the know of it, I hope that you get to that point that there are more that know than don't, because it's beneficial for all parties. And really, ultimately, yes, we want to be comfortable with what we do, but we really have to look at it. The easier it is for a physician to get credentialed or a healthcare professional, the better it is for the patient in the long run. Because I think the biggest impact, stress from the physicians in the hospitals, but it's the ease of use for end user patients to benefit from the great care that they can receive.
%.
Yeah. I'll ask you to step back into your physician position.
Okay.
So from a healthcare standpoint, could you give us one tip that would change somebody's health in a positive?
Well, exercise, move your body. My mom's friend eats dinner on the floor once a week. She's 70 and she's, solo. And she's like, I know that if I eat dinner on the floor and I can get up and down from the floor, then I'm unlikely to have, falls and hip fractures and stuff like that. And so stretch, move your body, exercise, even if it's a little bit. We all know that exercise has a way, 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 way higher impact on longevity than anything else. VO2 max and, strength training, specifically stretching, staying limber. And then of course, diet, keep the sugar low, keep the carbs low, keep the caloric intake low. There's good evidence around, intermittent fasting, and there's good evidence around saunas if you can handle it. And I think that if you just do those things, you're 10 million steps ahead of everyone else.
Yeah. I had never heard, nor have I thought of that about eating, from the floor. And I could understand that would make me better if I could get up and off the floor instead of the noise that comes out of me when I'm doing it to get up and down at the prime young age of 55 myself. So I love the share of that. Last question for you, Dr. Houston. You're on the Prime Health podcast. Hopefully it's a not deep thinker for you, but what would your definition of prime health be?
Prime health is all encompassing. It is not just your numbers and your biomarkers and all these things that a lot of people, especially in Silicon Valley, are like checking every month and all that stuff. It's how do you feel? Do you feel rested? Do you feel grateful? Are you full of gratitude? Do you feel supported in your relationships with the people that are around you? Do you feel like you're making an impact? Do you feel like you have meaningful work to do? I think health is all encompassing and it hits every aspect of your life. It's not just your physical well-being. It's not just your measurements and your VO2 max and all these things that I did mention. So that's prime health to me.
Yeah, I love it. Thank you for sharing that. Again, I love asking those last two questions because I don't get the same response. And if somebody else says eating on the floor, I'll be aghast at that if that comes up again. That's a very unique one for sure. So Dr. Houston, I appreciate you taking the time to be a guest here. As I said, I really learning more about this and I'll do more research on it. And I think it will, as you said, change the future of medicine in a very positive way. We've got some negative things that are happening on it, but I think it's positive for all three facets: the business of medicine, the provider of medicine, and the end user of medicine. It makes it easier on all three in those organizations, right? I mean, I would assume you'd agree.
Yeah. And the thing that most people don't realize is all physicians are super specialists in something. Even your hometown family medicine doctor has things that he or she is very, very, very good at. And that you wouldn't know by just looking at their credentials, right? They might have a super special, they might be hyper focused on, for example, hematology oncology because they had a family member, and they might be a better person in your hometown to go to if you've had a history of that than the, family medicine doctor down the street. And so having an opportunity to, in a granular way, search for the right doctor for you, the super specialists. I know a lot of physicians who are incorporating some of these newer functional medicine modalities into their practice, but they're not, it's hard to know who's doing what, who's actually using exosomes, who's actually using peptides, who's actually cares more about diet and exercise and is wanting and willing to have those conversations with you versus who are the doctors that think medicine is the best medicine and they're going to write pills and prescribe, because you want to find somebody who's aligned with your values, right? If you're not somebody that gives a crap about diet and exercise and you don't want to be bothered, you might want to go to the pill prescribing doctor, right? And everybody has a choice and everybody should have agency and everybody should be able to find the person that serves them best and find good matches. So that's what this is about. I'm really excited.
Yeah. Well, I appreciate you sharing that. So for the viewers and the listeners, please do yourself a favor and share this with at least one person, whether that's a physician or a patient because they typically see a physician. I think you can understand from what Dr. Houston has said, there's a need for more people to learn about Evercred because of how it can help the entire healthcare system. So again, I appreciate you being with us. From a selfish standpoint, please subscribe to the podcast and share with other people. But as I always say, until next time, remember, true wellness is a journey we are all on together. So whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So I always say, please do stay committed to your Prime Health journey. Again, Dr. Houston, thank you very much for being a guest on the Prime Health podcast.
Thanks so much for having me.